I believe that's what true integrative medicine is. It's not just integrating one or two other components. It's taking the entire breadth of knowledge that I'm able to accrue and providing that to my patients.
We have the how to live part, which is the integrative healthcare, and we also have the end of life care that is also very, very important.
By embracing and having the conversation about death, we can improve outcomes for patients and families at the point of transition. And I believe strongly that by talking about death, preparing for death, embracing that it's a part of life, it will help guide our spiritual practice throughout our lives to understand that this experience is a finite experience.
Today, we're going to talk about how to live and how to die. The second part of the topic is very, very uncomfortable for a lot of people, myself included. But we should know about certain strategies. We should talk about certain strategies so we can help the people that we love. If you've been following our doctors networking group, Polish Your Life, you know that we are all about promoting integrative healthcare. And that's because there are a lot of people who go from doctor to doctor, follow recommendations, and sometimes they still don't feel better. And I believe that's a big problem, and it's nobody's fault because there's no doctor who knows it all, who has all the answers and all the solutions. The power is actually in the collaboration, in bringing all these people together with resources. And also, it's not only what you do at the doctor's office, but also what you do at home and the lifestyle medicine we're going to be discussing today as well. So in the group and in this podcast, what we do is we search. We search for these amazing healthcare providers, technologies, resources, biohacks, and everything else, and strategies that you can implement. And we just bring them to you, and you do with the information what you want to do. Today, I think is going to be very, very interesting for you because in the context of what I just said, we have the how to live part, which is the integrative healthcare, and we also have the end of life care that is also very, very important. I am proud to introduce to you our amazing guest today because sometimes, as I sometimes say, when we are searching, we are finding people, and sometimes you find a gem that you feel has a very different approach to healthcare. And I'm very proud to introduce to you Dr. Gary. He is a pioneer in medicine and anti-aging. He's the founder of Evolve Healthcare. Dr. Gary is an internal medicine physician specializing in primary preventative care with a focus on lifestyle medicine that I mentioned, also anti-aging and end-of-life care. The mix of all these things is very unique. And after a few conversations, I will tell you I'm very proud to introduce him to you. And that's especially important if you either want to take your life and your health to the next level, or if you know somebody who's getting older and you feel like they are getting a little bit closer to that end of life and you just want to support them. Strategies that you're going to hear from Dr. Gary, I think, are going to be very, very helpful. Dr. Gary Shlifer, welcome to Polish Your Life.
Thank you so much for that lovely introduction, Mike. So excited to be here.
I'm excited to have you here. Dr. Gary, I cannot do an introduction that is going to explain everything to the fullest for people. What I would like you to do, if you don't mind, is just help me complete the intro with the information that you think our listener or viewer should know, keeping in mind that some doctors may be listening and also some individuals. So what should people know about you?
Yeah, I mean, I came to this practice of lifestyle medicine unintentionally, really. I was trained as an internal medicine specialist, and I went to Indiana University residency, which was a really robust and intense residency program, and very proud of that experience. Through it, I did become quite disillusioned with traditional Western medicine approaches to patient interaction. I was constantly frustrated in my clinic, on the wards, in the hospital, and in the subspecialty wards like oncology wards and liver cancer wards. And I had all of this great exposure, and I constantly felt sort of a lack of focus on the patient, on the doctor-patient relationship, and on the healing that can happen just through a conversation, through the connection that, the physician and the patient's family finds together. I I really connected with end of life care early in my career. I felt it was a place where I can make a meaningful impact on patients, families, and not just the patient, but the families. That was a real strong connection for me. And after training, I became a hospitalist and continued to be quite disillusioned. And I started Evolve Healthcare really with an attempt to find a space for myself where I can practice the kind of medicine that I would be more proud of. Not that I'm not proud of Western medicine. I think it's quite special and important, but has its limitations. I started Evolve 8 years ago, and then through the process, I self-taught and through the community learned a lot about lifestyle medicine, which I really think of as everything else that doesn't include just the Western medicine strategies. And I believe that's what true integrative medicine is. It's not just integrating one or two other components. It's taking the entire breadth of knowledge that I'm able to accrue and providing that to my patients. And that's where my primary care practice really found a special place in the community. Um, and then in parallel to that, which I also consider lifestyle medicine, end of life care became something that I focus on because, connecting with families, being a support system, educating patients and families on the transition process, is just something that's very missing in our community and just in healthcare in general. And there is a significant push by traditional medicine to grow that space because we have so many elderly, we have so many sick patients. And so to me, lifestyle medicine is the part where I help people optimize their health, live a long life, but live life of quality, right? And then at the end of life, there's so much that's done that's futile, and there's so many sort of ideas that aren't clearly explained. And so I guide people through that end of life process. And that's a lifestyle, essentially. It's a way of thinking about healthcare that's different than do everything in an ICU or pretending that this or that treatment might bring meaningful change, but instead being really, really honest, really emotionally and spiritually engaged. And through that, I've connected the two, and I found a very fulfilling practice and one that serves my community well.
I'll tell you, that's beautiful
Thank you.
because honesty is really needed in healthcare overall. People are sometimes sidetracked from what really matters. From the provider's perspective, it should always be the patient. But because the system is set up in a way where the provider is doing much more than patient care, I think it causes a lot of stress. And that stress, the patient feels that stress, right? And I'm always very optimistic, and I'm looking for people who can also lead by example and guide healthcare providers towards that more fulfilling lifestyle as a healthcare provider. And I think what you just described is it's a very clear vision for what you're building and why you're building this as well. On top of this, being able to be honest with people, especially when it comes to the most tough messages, because end of life and communicating a message that is really not the one that any family member or the patient himself or herself want to hear. Being able to communicate it honestly and, like you mentioned, guide them through the process. This is something that doesn't just require a shift in how you communicate. It requires a very specific type of person to be able to do that. And I want to compliment you on that aspect because I think other healthcare providers listening and watching can ask you, off camera, for a little bit of guidance, how do you do it? Because it requires some tough decisions. Okay, well, I'm going to walk in the room and I'm going to have to communicate something. What I would like to focus on, if you don't mind, is as you're going to be explaining, and you have so much value that within one podcast interview, it's not going to be possible for us to encapsulate everything. The things you choose to share with people, I would like to focus on the theoretical aspect and what it is, and also attach to it one or two practical strategies or tips that people can use both on the provider side and patient side. So when you meet people, let's maybe focus on the lifestyle medicine slash how to live portion of our interview first. When you meet people, what are some of the typical situations that you meet a patient in, the problems they're dealing with, and your immediate response and approach?
Well, I'll tell you, the first thing that I've learned in the clinic side of things, the sort of anti-aging preventative side, is meeting people where they're at. So in the beginning, as I've discovered nutrition and sleep medicine and various strategies for self-help, I always try to kind of share that right away. I was so excited to share my strategies of healing. And what I realized is you have to ask the very first question that I ask every patient, and you can ask any of the doctors or providers I've trained, is what is your goal today? It's such a simple question that doesn't get asked enough by doctors, and it really makes the conversation so much easier. Because as a provider, you have all these tools, right? And you may come in with predetermined ideas of what you want to do for someone. But if they're not receptive, it doesn't matter, right? I've spent 45 minutes educating someone on nutrition because that's an anchor point of what I teach. And if I didn't ask that question and they weren't openly receptive to it, it was like talking to no one, right? Because it's overwhelming. So much of what I'm talking about is you have to be interested in it, right? So
Of course.
meeting a patient where they're at, and this is probably true for both ends of the spectrum, but specifically, I think when you're talking about preventative lifestyle medicine and anti-aging medicine, where are you in your journey? What challenges have you faced as a patient? What are the frustrations? Empathizing and understanding those frustrations, echoing them even, so that you kind of create a nice even playing field between me and the patient. And that ends up being a really great platform to go wherever the conversation goes. And sometimes I think I'm going to talk about, you know, like I said, nutrition, and we end up talking about psychedelic medicine for mental health. Because when you open that door, it's so rare that a patient can really open up. And I think that it's a great place to start. That's kind of my advice for providers. I feel like providers get very stuck in, this is how I do things, this is how I was trained. And even if you have different ideas that you'd want to bring to your practice, it's hard to do that when you impose it onto
Of
people.
course.
So kind of letting the patient steer me or you as the
Mhm.
provider into that conversation has been a really strong strategy. Um, and I guess for patients in that regard, you know, if you're with a doctor that, or any provider that you're not connecting with, they're not looking at you in the eye, they're not giving you the attention that you need, and you're dealing with something difficult, especially, or you have a specific goal in mind, it's going to be very hard to get meaningful guidance. So I always say, don't be afraid to move on. Sometimes you have to shop around to find the best doctor. And I don't, I never take it personally if someone doesn't connect with me. I like to provide other resources, like I have a different kinds of providers in my practice, and I've done that very intentionally because there's no way one human being can connect with everyone. It's just impossible.
What you mentioned is so important because even if you have your, let's call this in a positive meaning of this word, agenda for how you would like that patient journey to be, from the diagnosis, evaluation, diagnosis, and then certain things that you're going to be able to do to help them, because the goal in mind for a provider is actually to give the clinical outcomes that the patient desires. When you start with the question that you mentioned, what is your goal today? You automatically give yourself a much better chance to become relevant, because anything and everything that you're going to say after, if it's not relevant to the very goal today, even if it's the right advice, by the way, it may not be relevant. So if I'm coming as a patient and the pain level, emotional or physical pain, is at 8 or 9, and there is an event happening, in 2 days that I need to prepare, the big lifestyle medicine protocol and program is going to be much less relevant for me than getting out of pain if I tell you that that's my goal. on the other hand, if somebody is coming to optimize, for a much better future, better life, and they need a plan of action and a strategy, then that would be very much appropriate. So even how you present the context of the information that is coming to the patient, that question is a question that I'm sure that if there is a provider watching who actually cares about their patients deeply, and they are not using this question, I think from this interview, that's one thing that already like a golden nugget that they can put a check mark on, that they can get. So for that question, what is one of the most common answers that you're getting from people that you see, typical patients that you see?
Yeah, for sure. The most common goal these days, especially, is how do I avoid being on a lot of pharmaceuticals?
So limiting the meds.
Yeah, or lowering or avoiding meds. I think, doctors are so quick to prescribe things. They're quick to make a diagnosis and a prescription. I always say if you go to the candy man, they're going to give you candy. It's meant to be in jest.
Yeah.
It really is. But in reality, it's how we're trained. Most doctors, we're trained to provide medications and procedures, right? And so that's where we go. Naturally, and oftentimes it's appropriate. There's a lot of issues and distrust with these three-letter organizations and just guidance in general. So my goal for patients is to mix lifestyle medicine with traditional Western medicine. So when patients come to me with a goal of being on as least drugs as possible, I really take them through what treatments make sense for them and what treatments can be avoided through lifestyle. And I almost never prescribe drugs on my first visit, because I think it's off-putting to most people, at least people that come to me. I do provide recommendations for supplementation. A lot of people are looking for that as well, and it's a very difficult world to navigate, the supplement
Yes.
world. I have a particular focus on it because I do think supplementation is so important, and most doctors aren't educated enough about it. So that's often a first move that I can provide people. And then it's always about sleep,
Mm-hmm.
nutrition, and spiritual or emotional balance. I don't tend to focus on exercise as much because I think that point has been belabored. Everyone pretty much gets it. The challenge often is getting the motivation to exercise. Most people, there's a lot of resources when it comes to movement medicine, and I think that most people know that. And just belaboring that point, when you go see a doctor, to me, that's a missed opportunity because everyone's like heard that already. So I try to bring up those other three factors, and I'll mention them again: nutrition, emotional, spiritual health, and sleep. And I all of those three things there's a big movement to promote that, and those are sort of the anchor points that I start with.
Yeah, that's I think very important for people to know. First of all, that this is part of healthcare, and their recovery journey from whatever problem or interference is in their health. Because many times the patient is gonna, and I see it all the time when people come to us as they have a problem and they're like, Mike, can you refer me to a good, and then you fill in the blank. And sometimes it's because they couldn't find the right person, but sometimes their mindset is not in the right place. What I mean by this is many times it's easy for a patient to blame the doctor, because they will say, hey, I came to this doctor, they gave me X, it could be a medication, could be a treatment protocol or program. Compliance on this is another issue that I'm not going to get into, understanding what they actually meant by giving them a recommendation. But a lot of times that is treated as like, hey, I went to the doctor, he's a specialist in the condition that we are treating, and now I follow the advice, and sorry, the doctor wasn't able to help me. He was not a good doctor. And they blame the doctor, completely removing the control and the power of the position of us as individuals when we are in the patient seat. Because in the patient seat, we actually have more control than most people think, starting with communicating the goal with the provider, even if they don't ask, say, hey, Dr. X, let me tell you, for today, if you could just let me speak for a quick second. For today, my goal is this, right? And communicating this, that's actually something that is within patient's control. And I think what you mentioned here is realizing that sleep, nutrition, movement, of course, and exercise everybody knows about, and also spirituality, all these three really are practiced outside of the doctor's office, but it's part of your recovery journey as a patient. So I think what would be helpful for people, if you could share maybe 2 strategies or tips for each one of these, right? So people can say, okay, that's what I can do when I leave the doctor's office, which can help you not blame your doctor, but actually have the outcome you're looking for. So let's start with sleep, if you don't mind. What would you recommend?
Yeah, so when it comes to sleep, I think it's one of the most underappreciated parts of lifestyle. And there's a lot more research and a lot more information out there than there used to be. My first recommendation is listen to Dr. Matthew Walker. I mean, this guy, he's a research scientist. I believe it's from Stanford. He wrote an amazing book called Why We Sleep. He recently did a 6-part series on the Huberman podcast where and I think it's phenomenal. It might be better than the book for most people because you could just listen to 6 episodes, and he's well spoken and easy to listen to. And Dr. Huberman does a great job guiding us through the conversation. It's so common that I give someone, hey, I'll ask this question, Mike. I'll say, are you a reader? Are you a listener? Are you a podcaster? Like I try to figure
Great
out.
question to ask, because how you want to receive the information from the doctor is also pretty cool to communicate. So yeah, to answer your question, I myself, I love listening to podcasts. So I'm gonna watch it on YouTube many times, but I actually listen. But I want to be able to peek in and see the facial expression as they're communicating certain things, because I feel like I'm connecting more to the message itself and to the provider. So for me, it's this mix between YouTube, video podcast and the audio podcast. I love audiobooks and receiving information this way because this allows me to have a walk in nature, grounding and other things like you mentioned in your strategies, and at the same time consume and learn and and be able to absorb the information that is needed. What a great question for a provider to ask.
It's really an important one because then you can get your patient to get educated. Because I always say too, it's impossible for me to give you all the education in one visit or 2 or even 3. There's so much to talk about. So figuring out where they can go get that information on their own and then guiding them with resources. So yeah, I always talk about Matthew Walker. And then I, a second factor with sleep is I screen everyone for sleep apnea. Sleep apnea, I believe, is one of the most underdiagnosed conditions and often a root cause problem to all sorts of things like high blood pressure, resistant weight loss, emotional issues like mood irritability and mood variability. So I always ask about sleep hygiene strategies, and I do blood work that can guide me as far as compare it with the questions and the blood work. Should I be doing a formal sleep test? I also look at vitamin levels, B vitamin, vitamin D levels. All of these play a role in sleep, and that's where some supplementation might come into play. That is a anchor point of what I do with the sleep part.
So which markers would you be, I would say, the top markers that you're looking at when you're evaluating somebody for sleep apnea and sleep issues?
The most common one that I think, doctors should keep an eye on is a high hemoglobin level. If you're on the high side of normal or above that marker, and also I recommend really doing your research on normals because every lab has different normal values. And you don't want it, it's easy to look if it's red or green. That's not our job as a doctor. We're the ones looking at the actual data and deciding if this is normal or not. So if someone is reporting sleep issues, they snore, they don't have restfulness during the day, or like they can fall asleep if I close the door and leave them there for 15 minutes, and their hemoglobin's running on the high side, that does key me into doing a sleep apnea screening, a formal test. You shouldn't have high hemoglobin levels. Hypoxia is a common cause of that. Obviously, there's other factors like smoking, etc. But these days, less and less smokers out there, and lots of people suffering from sleep apnea. So that's a great simple marker. pair it with your assessment, your conversation with the patient, and that can send you down a path of finding potentially a root cause problem for metabolic disease and mood problems. So that's simple, and I can't tell you how many people that are not overweight that I diagnose with sleep apnea. And I work with a local dentist who does sleep restoration. A lot of people are scared off by the CPAP, which is a device that people can wear. There's another treatment in addition to supplementation. It's an oral appliance that can be built and customized, and it can really make a dramatic impact on someone's life. So I talk about that a lot.
Yeah, that's amazing. And that also for everybody listening and watching, if you're watching this or listening, pay attention to the importance of collaboration between providers, because you don't have to be an expert in all of it, but knowing that there is a resource right next door, sometimes it's metaphorically speaking, it could be right next door, it could be, listening to that podcast that you mentioned about sleep, or it could be literally right next door that there is a provider that you're going to refer to get, the appliance that you mentioned. That's really important. It actually makes the provider's job much easier, because together you can treat the patient instead of just treating the condition through the lens of one specialty only. And that's, you mentioned this at the beginning, limitations in healthcare system, standard of care being, the primary one here, where providers are a little bit lost. And for an optimistic person like myself, trying to figure out, not being a provider, trying to figure out what that doctor should do, because the standard of care tells me I need to do this, and I cannot go, more to the left and more to the right within the margins that I'm told. But at the same time, I'm also aware of some other options that are beyond this. Um, Before we get to the next one, because you gave the two for sleep, how do you navigate this margin that you know what standard of care is and something is on the left or on the right? Do you communicate it? How do you navigate that?
It's a great question. I think the standard of care is pretty low. So I navigate it with eyes wide open and confidence that all of the information that I've accumulated is going to be meaningful to my patient. And I suppose, and this is kind of speaking to the providers again, without fear. I think we are trained to be very fearful of stepping outside of recommendations and standards. I think that's again a missed opportunity. We're trained to do a certain thing, and our training is often just the years that you spend in medical school, residency, and whoever your mentors were. But as a healthcare provider, we are committed to a lifelong process of learning. So every day that I walk
Well,
this.
you are not every healthcare
Oh,
provider.
I think
That's
though.
a good words of encouragement, by the way, for everyone. You
I
should be
think
committed to a
I
lifelong
think
learning.
ultimately everyone is. They just get burned out. Becoming a doctor is a really trying experience, and it really breaks you down. And I think a lot of the education process is meant to create people that follow orders. And that's fine.
Mm.
That's not the problem. The problem isn't following orders. We're supposed to. There's a lot of great guidance, a lot of evidence-based medicine that is meaningful. But it in fact is an art. It is not a science. Science inherently is mutable. It changes. The science is not out on almost anything. It's always changing. That is the point of being a scientist, is we have theories and ideas that we change over time based on new information that's presented to us. So I navigate outside of the standard of care confidently and with a strong fund of knowledge that is constantly growing, and understanding that every single person is slightly different, though we all follow similar patterns, and for sure, everyone's very similar. There's a lot of variability. And so you got to meet people where they're at. You've got to think about what that individual has gone through, and you got to create a meaningful recommendation, not worried about who might sue you or not. This is another common issue we face. Oh my God, if I recommend to not take this cholesterol medicine, I'm going to get sued. It might not make sense for that patient. Your job is to be the doctor, the guide, the healer. And that is your guiding light, not what will the billing company say or what the insurance company might come back with, that you can't start from there. All factors you should consider, but you can't start your treatment protocol from a place of fear and anxiety and lack of confidence in what your treatment protocol is. So,
So such a tough one to navigate, and thank you for sharing your perspective here, because I can imagine that a provider spends great amount of resources, time, energy, stress to achieve the degree. Then almost like mission accomplished, I graduated. Now, as you mentioned, with the proper mindset, it's a lifelong learning. So you're still learning. You know, healthcare is evolving, evolve healthcare, right? No pun intended, or maybe it is.
no, there was
So,
no pun intended. It was just a
yeah,
fun name, but
so healthcare is evolving. I think it's very optimistic. So that lifelong learning is a very natural and good thing and logical thing to also implement. I also want to be very understanding for the average, let's call the average doctor who is within the two margins, who says, hey, I'm not gonna risk all of that I have built for somebody to either financially hurt me by, like you mentioned, a lawsuit or something like that, or maybe just, losing the reputation or ultimately losing the license, right? These things are, I want to be very understanding. So what you are sharing is that there are ways to still be compliant with all the rules and regulations and not be afraid to communicate that there are some other resources and approaches. Uh, am I understanding it right?
most of the stuff that we recommend in lifestyle medicine or integrative medicine is not really that far off the beaten path. I think when you're saying out of the standards, they're not that outside of the standards. It's just there's a fear, or maybe it's not a fear, there's a habit of literally just doing what it is you were trained to do. But
Hmm.
there's more tools out there. So let's use the sleep apnea example. Sleep apnea screening is part of healthcare. It's a standard of care.
Right.
But being vigilant to the fact that it is underdiagnosed and is underappreciated and there's a lack of attention, you can put more focus on that and guide people that have seen six doctors and they don't know the solution, and that might be the solution. It's a very simple one, actually. So it's like
Hmm.
it's just thinking more broadly, would say, rather than thinking so far left or right outside of the standard, but rather looking at the big picture. And so I think oftentimes there's a fear of doing something that someone else didn't do, or if that makes sense, right? Just
Yes.
doing something else seems scary, even if it is within the standard of care.
Yes. I have another one that I think will be a little bit tougher, but you will have fun answering it. So that's going to the next point here, which is nutrition, right? Now, knowing your approach and how much you enjoy recommending the carnivore diet or low carb diet. And by the way, I'm very much with you on this. So I want you to know my perspective. I think there is a lot of benefits that are coming from this approach. But now we are looking at the guidelines for somebody, for example, with heart disease, that now we have that art and science kind of like colliding here. So let's talk about this one. How do you navigate this? And I'm very curious, and I want to encourage people to listen with open mind, because the people from the same camp will say, yes, that's my provider. The people from another camp, complete opposite spectrum, can say, that is not right because X, Y, and Z. I would like everybody to have very open mind, because we are not talking about what's better here. We are talking about the navigating along with the nutrition tips, but also navigating as a provider. If you think that something is appropriate for a patient in their situation, how are you going to recommend it if it doesn't really fit the guidelines exactly? Let's put it this way.
Well, when it comes to nutrition, uh, patients and providers should be acutely aware that we are very poorly educated on that subject. That is by design. So there is less than 10 hours, often less than 5 hours of nutrition education provided to a traditional physician. And I won't even speak to the specialists who are trained further in those bad strategies. When it comes to nutrition, that space has been purchased by the food and drug companies to be excluded. Now, I know this might sound scary or, oh, wow, that's tinfoil hat conspiracy theory. No, no, it's not. It's very simple. Nutrition, we all know, is the cornerstone of health. What you put in your body is what you get. There's no question about that. Then why is every physician not provided countless hours of nutrition education? It should be overwhelming. We should be provided a dozen tools in the world of nutrition to help patients. Not if you're a nutritionist or a dietitian, not if you're an obesity specialist, every doctor, because it's relevant to every single thing that we do, no matter what you do. Okay. And also for your own health. Giving a good foundation of what it takes to be healthy is how doctors stay healthy. And by being a healthy doctor, you act as an example to everyone that you're helping. So when I say that it has been purchased, that I say that because you're not taught about it, and not significantly. You're taught the standard guidelines that anyone can go online and search. It's the same advertisements that the lay person gets on TV, finishing med school, for example, and residency. For the most part, you don't actually know more than the average person walking the street about nutrition. You might think you do, but you don't, because eating 5 meals a day, breakfast is the most important meal of the day, the plate or the pyramid, whichever way the pyramid goes. These are old, redundant beliefs that are not that supported, and they're missing so much to it. So it starts there with nutrition. When you go into studying nutrition, you find out that there's lots of different eating strategies. You find out that doing feeding studies, which is actually where you feed people and you control variables the way you might do a drug study, is extremely difficult, costly, and there's very few feeding trials out there, period. The research that exists on nutrition is observational research, which is the lowest kind of research because it's questionnaires. And that's just realistically the best, easiest way to get information about that. So when you take into account the lack of education that we're provided, when you take into account the overwhelming amount of poor quality evidence, the lack of really robust, rigorous scientific research, you're left asking, well, do I actually know about nutrition, or am I just repeating something that everyone else has been repeating for decades and decades? And that's really what's going on in the healthcare space. And that's why you see such a dichotomy or like a variety of guidelines, or not guidelines, recommendations from doctors. I mean, you have a cardiologist down the street that's promoting a vegan diet. You have another doctor that's promoting a carnivore diet. Someone else is like, oh, you got to do the DASH diet or the Mediterranean diet. And when you ask, like, what is really going on, they don't know. Most people don't know. Most people aren't obsessed with nutrition the way I am. And what I'm promoting to my colleagues and to people in general is nutrition is what you should be obsessed with. It is so important. And there's so much money to be made, meaning that large corporations, and this is globally, make so much money on food. And the poor outcomes that come from poor quality food, there's so much money to be made on pharmaceuticals and procedures that your job as a provider and as a patient alike is to become as close to an expert on nutrition as you can be. And I really discourage this idea of, oh, I found Dr. Gary, I'm just going to listen to everything he says. No. Listen to everyone, have an open mind. Like you said, Mike, like have an open mind and listen to multiple things. I really discourage people making decisions based on emotions, based on a documentary film that comes out every 3 years with pictures of sad animals, or a documentary film made by a carnivore that's like flexing his muscles so that you make like this. It's these emotional triggers that people get attached to. It's not a good way to make decisions about your health. Your health, especially nutrition, needs to be something you really understand. Because when it comes to nutrition, you're cooking at home, you're shopping for food, you're eating out and making selections with your restaurants and what you order at restaurants. It's a very dynamic process. And so I teach patients and I talk about all those different layers of where food comes to us from, how it's sourced, what are the labels, how do you read labels, how do you read ingredients, how are foods processed, what are the different oils, what are the different fillers, what are the different ways we ferment and we cook and we do all these different things with food. And what I recommend is understanding the history of food. Because what you realize is we have been eating in different ways for millions, thousands of years, right? We've only had this modern food system, let's call it 100 years. In that 100 years, while Western medicine has made great strides with things like infections and treatments of trauma, we have seen a dramatic increase in chronic disease. Chronic disease is by far the worst it's ever been, not even comparable. The last 3, 4 decades have shown a rapid progression, especially like in America. It started in the 50s and 60s. Now you're seeing it in other countries as they've adopted Western eating strategies. And this chronic disease epidemic, that's mental health, that's obesity, that's cancer, that's brain disease. I mean, the list goes on and on and on, right? Is driven by toxicity in our food. Not entirely, not entirely, but that is the main driver of disease. It's not like in the last 100 years, our genetics changed, right? Genetics take tens of thousands of years to change. What's changed is how we eat, what we eat, how we process our food, and that is driving disease. So when you hear this and you're like, oh, he's a carnivore doctor, that's crazy. Don't get so emotional. Just step back and ask yourself, what's really going on here? You will quickly accept the fact that people are getting more chronically ill. That's undeniable. And if you start looking at the history of food, and I can give some great references, I like there's some books that I really enjoy. You'll understand quickly how we got here because the history of the food system is really where we went wrong. If I can recommend one book, it's called The Big Fat Surprise by Nina Teicholz. She's an amazing double PhD. She just recently got an honorary PhD from, I think, Cambridge University, some very prestigious university, because she's done so much work over the last 20 years in the world of nutrition. And whether you believe in eating a carnivore or a low carb diet, if you really believe in a plant-based diet, that book will tell you a lot about how our food system got so distorted. And what we all agree on, where at whatever camp of nutrition you live in, we all agree that this processed, highly inflammatory food products are making us sick. And so whether you go plant-based or animal-based, whether you do intermittent fasting or not eating garbage processed inflammatory foods that really have no business being in our food system is something we all share. It's a
Yeah.
commonality. So I have patients in my clinic that are vegans and vegetarians and pescatarians and Whole30 people and carnivore people. I don't care. We all agree that the food system is broken and our job is to navigate through it. And that's the biggest lesson. I have my biases of what I think is an optimal human diet, but that might not be optimal for everyone, and everyone has their own emotional and sometimes religious,
Yeah.
issues,
Cultural.
cultural. That's the point. So that's the point. It's not about finding a camp and
Mhm.
planting your flag. It's about really understanding how bad our nutrition landscape is, accepting that to be true, and moving forward from that starting
You
point.
know what I absolutely love about what you said and how relevant this is to both providers and patients is looking for commonalities here because frankly, you are in the same camp than people who recommend different types of diet most of the time comparing to your average recommendations. But you do agree that highly processed food is junk that nobody should be eating. That this, high level of sugar, that these unbelievably dangerous artificial sweeteners we should be educated on. And if something is sugar free, that sometimes could be even worse than sugar. Like these things, there's a lot of commonalities. And I love what you said, focusing on the commonalities. And you also mentioned something that is very important, and I want everybody to pay attention. It may not be the right thing for you, or something like this that you mentioned. So it's not that Dr. Gary is going to recommend carnivore to every single person who comes in, because it always needs to be customized. And that's what I was curious what your answer is going to be on this one. We do have definitely one tip here, because I was looking for these two tips, right? So one is eliminate processed foods, and I love that because that's something that is a common denominator for a lot of doctors. And I'm looking for another one that is going to be a little bit more spicy, something that maybe people don't expect. It would be cool if you do something that is more towards carnivore, and the research, that would be great. But I wanted people listening and watching to know that I also realize from our experience in our family that sometimes it's not even what diet is the right one, but it's also what diet is the right one for the right person and also at the right time. So it's so complex that I don't think we're going to solve it in this interview. But I was curious if you are recommending carnivore basically to almost everyone, or is this something that you are willing to customize and adjust? And I'm happy to hear that you are adjusting this.
Yeah, well, you're right, Mike. We can't even do it justice I mean, I have 50 episodes, 100 hours of content talking about nutrition, and that doesn't even do it. I mean, you really have to spend a lot of time learning about it, and that's why I think it's so important that doctors and providers especially learn, because every little bit of knowledge is going to get you there. I'll answer your question in this way. First of all, carnivore is not a diet. It is a nutrition strategy.
Mm.
I come to nutrition from the perspective of ancestry. We are, in fact, Homo sapiens that have a very robust history on this planet. And I don't need a double-blind placebo-controlled study or a feeding study to understand how we eat and what is a normal human diet. I look at it through a multidisciplinary perspective. One of my great mentors in this space is a paleoanthropologist, looking at bones, looking at teeth, looking at skull, looking at brain size, looking at how our guts work, the acidity, the length of our guts, the changes over the millennium, the years of change, thousands, millions of years of change, and how we evolved to be this animal. So a lot of my nutrition perspective is anchored in thousands and millions of years of understanding human beings rather than 100 years of research science meant to sell food products.
Mm-hmm.
So I've divorced myself from evidence-based medicine as it pertains to nutrition because the picture is muddied by money. It's just
Mm.
of all the parts of medicine, the world of nutrition is probably the most muddied by money. And nutrition and pharmaceuticals go hand in hand, but we're focusing on the nutrition part. I've stopped trying to argue plants versus animals. It's just too nuanced. Sourcing high quality plant food and high quality animal food and understanding what our requirements are to thrive as a human is really where my guidelines. So for some people, carnivore is a great strategy to be implemented for months, maybe a couple of years. Sometimes it's a strategy that's implemented on an intermittent basis throughout the year. Sometimes, like in the case of women, we do carnivore for part of a month, depending on their cycle.
Really?
It's incredibly nuanced. And I have great resources. Dr. Mindy Pels wrote an amazing book.
Yeah, she's awesome.
Yeah, guiding females. So, I will say this though. Intermittent fasting is the most powerful strategy for health that I've ever learned in all of healthcare in my entire career. It's something that was aggressively dismissed and even demeaned as I was learning about nutrition. And that made me very acutely aware that it was going to be effective, because anytime something is really, really effective that doesn't make people a bunch of money, it gets really pushed down and fear mongered because it's going to hit someone's pocketbook at the end of the day. There's a lot of like, oh, it's dangerous. Oh, you can't do this. You can't do that. It's nonsense. Taking a break from eating is a great way to let your body heal, without going into things like autophagy and gut health and letting your gut, flora restore themselves and all of these amazing benefits. It is a great way to sort of rattle the cage of someone and say, hey, you don't need to constantly put food in your body. In fact, it's impossible that that's true for all of the thousands of years that humans have existed. We didn't have refrigerators. We didn't have pantries. We didn't eat. We didn't wake up and stuff food in your mouth. It's impossible to be true.
Or even before we wake up, some people like literally in the middle of the night, half asleep, will go to the refrigerator and eat. And it's sometimes it's not their fault, right? Because it could be, different mechanisms in the body that will kind of like trigger, trick your body to think that you have to. Oh my goodness, I'm very excited, and I know we could go down this rabbit hole very, very deep. So for the purpose of getting the interview structured for the viewer or listener, I want to move to the next one, but practice intermittent fasting, or at least look into it with an open mind, right? Because it may help you a lot. Spirituality is the next one you mentioned. I think mega important, and that's the one that, because it's between taboo for some people and completely not understood by some other people, a lot of people just kind of like push it to the margin of healthcare, but it's not, because spirituality is very much part of integrative healthcare. Give me your perspective, please, as well as these two tips, and feel free on this one to start touching on the end of life as well. And I think that's going to be really important for people to understand how we transition from this amazing journey that we have here on this earth in this vehicle called our body, to the spiritual world that also, for optimistic people, actually gives a lot of promises that this is not in nature. I mean, at least I believe it. In nature, nothing really is over. It just changes the state, and it's very, very optimistic. And I think with what you're going to say, I would like people to understand, when we talk about how to die, we don't want to make this a really negative part of the conversation, because there is a lot, with proper mindset, there is a lot to be, I don't want to say looking forward to, because we do want to be here for as long as possible, as healthy and happy as possible. But there is a lot of hope, is what I want to tell people. And tell us your approach. How do you see it?
So with look, I think that spirituality is the missing piece in healthcare. I think it's actively sort of pulled out by this belief and blinded trust in science. This idea that everything must be measured, and if I can't measure it with my tool, it's not real. And I think that that's a missed opportunity. A missed opportunity to really help and connect with someone. Uh, 50 years ago, we couldn't really measure specific gene mutations, and we couldn't do an amazing array of treatments that we can now. Does that mean it was impossible and it didn't exist? No, we just hadn't created the tools, right? So with spirituality, I believe strongly that there is a spirit world all around us. Now, spirituality tends to live in the world of religion, at least in our society today in 2024. And yet, you also hear people talking about, hey, I feel this guy's a bad vibe, or, oh, this place is a good vibe. So what are you talking about? What's a vibe, right? What's a vibe? Well, we have to come up with different words to describe something that we feel. It affects our mood. It affects our biology. It affects our hormone system. It affects our thinking. And yet you can't measure vibes. And maybe some people listening that I got a tool for that. And yeah, there are different strategies. It's going to get into a very like niche space, but for the most part, especially in traditional research science, we can't measure spirit. We can't. We've yet to identify the source of like what someone might consider a soul. We don't know, they've looked for that in the brain. There's a lot of arguments about what is the soul or what is the spirit world. It even gets into some of the more interesting research in the world of physics and dark matter and multi dimensions. And it's, and while if this was again 50 years ago, that would have sounded crazy. Now that's the prevailing theory in physics, that there are multiple dimensions. I mean, it's actually the only way the mathematics of our physical world would make sense when you look at modern theories in physics. Again, not for this podcast, but like that's something to be considered. So when I think about spirituality with my patients, I talk about, well, one, if they have a religious practice, I embrace it. I think this time is very contentious, and I believe strongly in embracing our religious ideas, uh, not too extreme, but certainly to help guide our spirit. I believe strongly that various lifestyle practices, things like deep breathing strategies, mindfulness practices like meditation, uh, things like cold and heat therapy, even though they have these biological effects, actually connect us to being present and sensitive to the environment around us. And I believe strongly in avoiding as much as we can sedating and suppressive medications and things that sort of distract us, and instead embracing practices that make us more aware and almost dissolve the ego and allow us to be present in the moment with each other, with our natural world. So you mentioned something like grounding. I think that's a spiritual practice, connecting to the earth, connecting to the nature around us. I think deep breathing, our breath, is a huge component of that. And that's a part of practices like yoga and meditative practices, and part of lots of religious experiences of doing breathing exercises. And breathing exercises are extremely underappreciated as to how much they can affect our physiology. Our blood pressure, our cortisol and hormone levels are dramatically affected by breathing strategies. I mentioned the heat and cold therapy, but I will also mention that I'm a big proponent of what we're seeing right now, which is a revolution in psychedelic medicine. So there's an overwhelming amount of research looking at various substances that help dissolve the ego and connect us to a different part of our reality. And whether that's just an altered sensorium, like, there's a lot of research in the world of LSD, even though that's not going to be legal anytime soon. It's been used for decades and decades and decades. And this amazing research scientist, Stanislav Grof, wrote this amazing book called The Way of the Psychonaut, that if you just want to read about something that's fantastically interesting and sort of off the beaten path, this guy is in his 80s now and wrote this amazing book about work in LSD to help with spiritual and emotional issues. But what we're really seeing right now is a huge movement that's evidence-based, looking at products like ketamine, psilocybin, MDMA, and there's others, but I'll mention those specifically, uh, to help people break free of their emotional sort of blockades and work on the shadow work, the deep-seated, sort of subconscious work, so that they could find freedom from their emotional issues. And that to me is spiritual work, because it's very hard to understand what is happening when those substances are in our body. It's very hard to understand specifically what our emotions are, like this model of, oh, you have a lack of serotonin. Well, that's disproven. So that foundational psychiatric model that you have, if you're depressed, you have low serotonin, and I'm going to give you this drug to raise your serotonin. That has, of the last few years, been foundationally disproven as a model for depression. That does not explain depression at all. So what is it, right? What is it? Is it
Right.
just a neurochemical imbalance? I think not. I think it goes deeper. And I think that's where the spirit world comes into play. There's other powerful modalities around the world. I'll name one, like ayahuasca ceremonies. There's a variety of tribes and cultures around the world, specifically in South America, that use that product. Ibogaine, mescaline. I mean, there's a lot of products that are used, and cannabis on some level.
I have a question on this at this moment, and please don't lose your trail of thought. I'm just curious because somebody listening to this can put these two together. And as I'm trying to process the information, there is one important question to ask you. You mentioned about the importance of being present, right? You also mentioned the importance of, considering the psychedelic medicine. They will also help us be more present, and also not only psychedelic medicine but also the strategies, spiritual strategies, like even hot therapy, cold therapy, heat therapy, etc. Grounding, being spiritual, more connecting us to the present. But now if we put them in one basket, let's call it, and then you look at somebody who is currently in a some kind of a spiritual experience of having ketamine, you would not call that they're present. So how are we connecting these two to make sure that logically it makes sense?
Great question. So I mentioned the book by Stanislav Grof. He coined the term, I believe he coined it, a holotropic state of consciousness. Okay. A holotropic state of consciousness, as he describes it, is a state of consciousness that connects you to the whole. Okay. So when you are sitting here in your thoughts of anxiety, or because you're worried about the future, or depression, you're worried about the past, or you're just fixated on something, or you're having a fixation on like a substance, like an addiction, right? You're not connected to the world. You are very much in your own head. So you're not you when I say present, present not in your head, oh my God, I'm thinking about this. That's not present. There is an entire world, an energetic world around us. Uh, the plants, everything around us has an energy, right? And to be connected to that whole is the goal. So the way you connect something like deep breathing strategies, fasting is even a way to connect, have a holotropic experience, intense prayer or meditation, or these substances like ketamine and psilocybin. They are creating a holotropic state of consciousness, a state of consciousness that is altered from your common day to day, and yet more connected to the whole. Our brains are powerful, powerful filters. They take in all of this information that we're getting from all of our senses, and they filter. They get rid of most of it. You're getting, don't quote me, but like 10, 20% of what you're taking in is what you're experiencing. Because if you were feeling and sensing and processing everything, you couldn't make yourself a sandwich. It would be too much. So our brains, and this comes from the world of neuroscience, this is evident that our brains will cut out so much just so that you can function and survive as a creature. And so that is how these things connect. We are so stuck within ourselves and stuck within our rigid structure, and we create these survival mechanisms to just get through day to day. We get disconnected from the natural world, the spiritual world, and even just the environment around us. We're very good at blocking things out. So whether it's a psychedelic substance or a breathing strategy, or sort of an environmental strategy like by cold or heat therapy, or even fasting, all of these ultimately are driven towards creating a holotropic state of consciousness. And I think that's the best word I can use to describe that connection. And I think that that's where the spirit world lives. It lives outside of in here. It's out there. When you get into sort of different religious and spiritual practices, there's this idea that our mind can be connected to the whole world, and all of us are connected through vibrational energies. And so that's what we're trying to tap into. And that's what I think it's completely ignored in my training, and it's completely ignored by research scientists, and for the most part, although not completely. And I think it's where we've really lost our way as healers. We've lost our ability to understand that there's more to healthcare and healing than just the things that we can measure. And we can know things by experiencing them. We can know things through tradition and history. And just because you can't measure it and put it in a pill doesn't mean it's not real. And
Of
it's not
course.
critical.
Yeah, and thank you for explaining this, because that's the even the definition of presence. What does it actually mean? That the people can have a different definition, and the conscious presence, and then being unconscious at the same time, connected to the whole, like you mentioned. Very important for people to know that all of this is also in the context of integrative healthcare. How does that influence the physical body here, and the processes and the speed of different processes, and the direction as well. And we can influence it if we know the strategy. So, psychoneuroimmunology, for example. So there is also a ton of different research that is in that regard, but when it comes to implementation, it still becomes a little bit of this, voodoo, category that is not really proven by science, but definitely very, very promising. What are two strategies that you would recommend for people, or tips that you would recommend for people to consider?
Yeah, I think there's two really obvious ones. One is deep breathing strategies. I really think it costs you nothing. It doesn't take that much time. There's a number of ways to do it. I am a big fan of Wim Hof. Uh,
Mm-hmm.
he is just a very easy, simple, he's well spoken. You can find
Yep.
podcasts. He's got a book.
Yep.
It's called the Wim Hof Method, which he
Well,
paired.
it's easy if you take out of the equation getting into cold, because I
Oh,
still
right.
am, but
So
the
definitely
breathing part
not.
is easy.
Yeah, definitely. And that's what I recommend to people that are starting out. The cold part, he pairs three things: meditation, deep
Right.
breathing, and cold immersion. Just start with the deep breathing. It's good enough to start, right? And his way of breathing is very simple
Mm-hmm.
and very effective. And there's a lot of breathing strategies out there, and people do breathing workshops. And my point about it is you don't need to go anywhere. You could just find a little YouTube video or a podcast where they take you through it. It takes 15 minutes, and you can change your state of consciousness in 15 minutes.
Just get it in. He says just get it in, right? And
Get it
like people
in.
ask him nose or mouth, and he explains the method, but he also says it's important to just get it in. And I think a lot of us, including myself, are still trying to master it. And I think I overcomplicated like which breathing technique is going to be the best. And I will have some off podcast conversations with you about your recommendations. I think it's important. It's so easy to forget. Like you can go the whole day, the whole week without ever actually consciously influencing how you breathe. But that's yeah, like getting that oxygen is kind of important. Like we cannot live without it, and I'm talking about minutes. Not like without water we cannot live, but at least we can live more than without oxygen. So for people listening or watching, breathing exercises, Wim Hof method being one tip that you have for people. Super. What would be the second one?
Just an important basic connection to the natural world. So making a real serious intention in the morning to go outside and get into the sun, if the sun's out, and get that sun on your face, on your skin, on your body, get your feet onto real ground. Uh, it reminds you where what is actually real. It's not the cement pad that most of us are sleeping on. There's an actual Earth, and it has an electrical signal, and there's a sun, and that is a giant nuclear reactor projecting all of this energy onto us. And we have evolved with those factors. And so our hormones respond to that, things like melatonin, serotonin. uh, Really, our entire body has circadian rhythms. And so by being able to have a morning routine where you go put your feet on the ground and get your face and your body in the sun, and then simultaneously, if possible, being outside as the sun is coming down and participating in that sunset moment. There's a reason why sunsets are so beautiful and everyone loves that moment. It's really important to tell and train your body that it's time to relax. Sleep is upon us. It's in the next few hours of our lives. And of course, different times of year, whatever. This is just like a general point. But connecting your body to the rhythm of the days and the rhythm of the sun and the feeling of the ground, it's so simple. Most people don't think of this as a spiritual practice. It's very much a spiritual practice. That's probably the best word to describe it. Why, is grounding important? You can get into the electrical, this and that. It's connecting to the spirit of Mother Earth. It connects you to how you evolved as a person. And that is, again, the anchor to everything that I think about in healing is you are an animal that evolved over millions of years. You have evolved to be the alpha species on this planet. We're very in tune with this planet. We're connected to this planet. That's how we got to this point. We've done a bad job staying connected. So that's the message here. And so those are two easy things you can do. It costs you nothing, and you can do it every day for free and start building a spiritual practice that could transform your life.
I love that. And thank you for sharing these, because that's what sometimes is lost in, when you listen to a podcast. It could be trying to go 17 different places, but really, what are the action items that I can get from a podcast like this, as a provider and as an individual? And from today, I'm learning a lot from you. I'm also understanding the context for each one of these, which is a big thank you to you, because you're not just spitting out the tips and strategies, you're also saying why these are important. What I would like to talk about just a little bit, at least, is the topic that a lot of us avoid. And I think subconsciously I was trying to avoid it on this podcast, but I'm not gonna let it slip, because this topic is important for a lot of people. I'm talking about that end of life. I'm talking about how do we, like you mentioned, how to die. Very hard for me to even say it, right? Because we don't want to optimize for that. We want to optimize, like Brian Johnson says, don't die. And I would subscribe to his philosophy in that regard. Not necessarily that I would track so much and make my whole life about, preventing that. But what I'm very curious about is, how do we navigate that really difficult part that emotionally is even hard for us to process, that there it might be, and likely there is, an expiration date? How do we prepare, and how do we help other people?
Well, it is hard to talk about. And I think that's the point. I think you will live a better, more fulfilling life. You will feel more purpose and guidance if you embrace the idea that you're going to die. I think that there's this idea that, oh, some maybe in our lifetime they're going to figure out how. No, that we're very, very far away from Brian Johnson's goal of living forever. And even that, his goal is just to extend life. So even if he's successful in his endeavors, perhaps he can add 30 years, maybe optimistically 40 years. But, you know, we have an expert. Every death is the great equalizer. Doesn't matter how wealthy you are. It doesn't matter where you come from. And everyone is going to die. Uh, I don't foresee that changing. Perhaps it will. But the reality is, as of today, people are dying. In fact, in America now, the life expectancy has gone down a few years over the last decade. People ignore death and let it destroy their emotional and spiritual side. Families go through so much turmoil at the end of life because they're not prepared for their loved one passing. It's not talked about enough, so there's not a great communication on goals of care at the end of the life. People tend to make decisions and get confused, and they get really like sort of floaty when this issue presents itself, which it will for everyone. Everyone's has a family member that's going through it. This is, while it feels like something that people don't want to talk about or people don't have a lot of relationship with, everyone does. There's no avoiding this because it's like death and taxes. That's the funny saying, but it's true. It's very, very true. So I believe that if we reconnect with death, and we used to be connected with it. So again, back to history, about before like the 1930s, 1920s, 80 to 90% of people died in their homes. There wasn't hospitals everywhere. Death was a part of life. People, death rates at birth and with mothers during these were commonalities. Like people had death in their family like all the time. Of course, Western medicine has done a great job of preventing a lot of preventable deaths. But then you have this growing elderly population, you have this growing population of chronically ill people, and we have now the flip. Instead of 90 or 80% of people dying at home, 90 or 80% of people are dying in the hospital. And that is not a great place to die. It's very isolating. It's very cold. It's very emotionally and spiritually sort of washed out. There's a lot of procedures and interventions that do not change the outcome and actually induce suffering because our healthcare system is built to treat traumas and infections. That's where modern Western medicine evolved from, is the treating of traumas and infections, and is not built to treat chronic diseases and also not built to help people with transition. Now, over the last 20, 30 years, there's been a huge push, and thank God for it, into the world of hospice and palliative care medicine. And that is because people are suffering at the end of their lives. They're utilizing the healthcare system without benefit. There's a massive expense to the healthcare system with outcomes that actually cause harm, which my job is to do no harm. So by embracing and having the conversation about death, we can improve outcomes for patients and families at the point of transition. And I believe strongly that by talking about death, preparing for death, embracing that it's a part of life, very important part of life, it will help guide our spiritual practice throughout our lives to understand that this experience is a finite experience. And every moment and every day is fleeting. And every moment you don't spend doing something you want, or you have to do with passion, or something that's going towards an ultimate goal, or something that serves you and your family, then that's a lost moment. And that perspective is something that can give people hope. So the counterpoint of life is death. And that counterpoint gives us an opportunity and a perspective to which we can live our lives. So for the average person listening to this, who might not have a loved one dying acutely, they could think about this topic in a way that gives them a goal, a motivation, and a spiritual connection, because death is very much a spiritual experience. And for people dealing with death, or who have grandparents that are nearing the end of their lives, or parents that are nearing the end of their lives, preparing for it, understanding the resources that are available to make that transition, possible and dignified, understanding the pitfalls of our healthcare system where things can go wrong and bad things can happen that you can't take back. And once it happens, it can be tragic in many ways. Understanding how difficult and yet navigatable, like something that you can navigate, um, that process is. That is what I hope to convey to people over the coming years, that it's not this scary thing. There's nothing to be afraid of. It's coming. It's unavoidable. And that's not scary. That should be inspiring because it's reality. And I think living in that place of reality and avoiding this fear-based relationship to death is going to help a lot of people come to grips with how to help their family, how to help themselves, and how to make the best decisions for themselves and their loved ones.
So how can someone prepare or help another person prepare? I'm trying to find, without going too deep on this subject, some mistakes that you can see because you have a lot of experience with helping with that guidance, right? You have seen more situations than most people have. With that experience comes the value of sharing something that is a mistake that you can see many people made that somebody listening or watching can prevent. What would be maybe number one, without going too deep, number one mistake and strategy for that?
So there's a term in end-of-life care that we say advanced care planning. Sounds pretty ambiguous, but it's very simple. Have a conversation about what your wishes are if you were unable to make decisions and were in a critical situation. Okay. That's something called an advance directive, where you say, I do not want a feeding tube, or I want or do not want to be put on a life support machine. I want or do not want to have chest compressions and electrical shocks to my heart. So it comes up sometimes with elderly people, but I can't tell you how many patients I have in their 80s who have never had that conversation with their children. Like, have that conversation before the moment arrives where you have to have the conversation. Because when that terminal diagnosis is made, or when that critical fall or critical stroke or heart attack happen, emotions are high and people lose themselves in it, which is fine. Of course, it's scary, of course. But by having an advanced care planning discussion, and I have those conversations with my wife today, and I'm 30, 39. I want her to know what my wishes are. My parents are in their 70s. I've had that conversation and we talk about it from time to time. Because we should have a choice of what the end of our lives should look like. And when we can't make those decisions in most states and in most situations, that's going to go to our partners or our families. And if you've never talked about it, sometimes bringing it up and the son or the daughter, they just start crying. They can't talk about it. Okay, that's attempt number one. Attempt it again until you can actually understand what you would want. And the biggest mistake that I see is a disconnect between what the patient wants and what the family wants. You see, someone who's in their 80s or 90s might be spiritually, emotionally very prepared for the transition process. They've lived a long life and they don't want to have everything done to them to extend their life by months or days or weeks, right? They want to transition to the next part of this existence with dignity and have their vessel, their body not traumatized and destroyed. They don't want to be put on machines. And yet, if that conversation doesn't happen, then the people that do make those decisions make the decisions that their emotions tell them to make, right? I love dad. I want them to be with me, do everything. But would dad want that? Because
Wow.
that's the real question. What does dad or mom or whatever want? It's not what you want. What you want actually has no relevance. You wouldn't tell, them how to, you know, they make it. I'll put it this way: they're the ones that are going to decide if they're going to they break a leg and they want to fix their leg or not. They can say no. Now, most people wouldn't, but they could. You have free will to make a decision, correct? You're an adult. Uh, well, that should be the case at the end of life, and people should not be forced. Well, forced. They should not have these procedures and interventions put on them that often have no benefit. And it used to be the case where a doctor would say, family, this isn't going to change anything. And so we don't recommend this. But we don't have that kind of healthcare system. We have the kind of healthcare system where you end up in the hospital and their job is to get you out of the hospital in X amount of days and just do what it takes to deal with the issue. So you have a stroke. I'll give an example. It's tough to hear, but like a patient in their late 80s has a stroke and they can't swallow anymore and they can't move their bodies anymore. They can't talk. And the doctor's going to be like, oh, do you want a feeding tube? Do you want this? Do you want that? And yeah, yeah. Okay. They get plugged into all these tubes in a breathing machine. And now the patient's sitting there. They can't communicate. They're being sustained by these life support machines. And it's a miserable existence. Now, my point is not judging anything. My point is having a conversation throughout the course of life to understand what someone's wishes would be at the end of life. And sometimes they don't have that answer, and that's okay. What we know actually from research in the end of life care space is those conversations lead to better outcomes at the end of life, and outcomes measured by like even the patient as they're passing, they've asked some questionnaires. How prepared are you? How do you feel like you've been dealt with? There's a lot of research in the world of end of life space that guides a lot of what I'm talking about here. A lot of like trauma with the people that are left behind, how they felt things went, how watching the things that happened to their loved one, and how it affected them. And so what generally happens is it's left until the last minute, and the healthcare system is moving quickly, trying to get people in and out. There's not a lot of time to have thoughtful analyses and time to process feelings. So I really encourage people to talk about this early, as is reasonable, so that you could better understand what someone would want at the end of life. And I think that, if you have a grandparent who is over 65, especially if they have some medical problems, or even if they don't, it's a simple conversation. And sometimes that brings tears, right? Sometimes that brings sadness because you're acknowledging that this person might be nearing the end of their life. And that's okay. Sometimes I'll give another kind of unrelated thing. When someone is passing and they're laying in bed, and I see families struggling, and I see a struggle, there's an energetic spiritual energy that that's palpable to me. And what I will tell someone, like a family member, is give this person permission to pass. And this has happened hundreds of times in my career where a patient's family has given permission to their loved one to pass, and it happens within minutes or hours that they actually pass. And I strongly believe that what's happening there is that these conversations, these acceptance of what is going to happen, doesn't occur. And so you have this spiritual blockade that occurs at the point of transition where the person, they may not be able to talk or hear. We don't know what they're able to experience, but they're holding on. And the family members are not letting go. And I believe that there's a very powerful spiritual connection there. And when I give that advice and a patient, everyone feels better. Okay. Everyone feels a sense of relief, because that transition process is a very trying time. And yet it's unavoidable what is going to happen. So by guiding someone to give permission for transition, I believe in that moment there is a spiritual, energetic shift that is extremely powerful.
Wow.
And that's the connection. And that's an experience that I've had thousands of times. I've been in that room thousands of times in my career, and I've guided people through that moment so often. And so when someone tells me, back to the earlier part of our conversation, oh, I don't know, the spirit world doesn't exist. I can't measure it. Well, I can feel it, I can see it, I can navigate it, literally navigate it at the end of life. So it certainly exists in that moment and in those moments. And so obviously it exists throughout the course of your life. And so perhaps by talking about death, it almost creates a framework for talking about spirituality, because that is where you can't avoid that moment. That is a spiritual moment. However you look at it, there is something more happening than just electrical signals and neurochemical signals turning on and off. There's something deeper there that we have not yet been able to pinpoint, but it's there. And just talking about it gives us some frame of reference to the spiritual crises and spiritual battles we face throughout our lives.
Yeah, but so powerful what you said, and I will let everyone process it the way that they should process it themselves. I think for me, the biggest optimistic, because I'm always being an optimist, I'm always looking for these optimistic points of view and optimistic messages within that tougher message that, end of life as we know it here, maybe coming, and maybe coming to all of us, and we need to confront it, acknowledge it first, confront it, have a choice to have a conversation about it. What I love about this is we choose, and we have the choice if we're going to ignore it completely, and then it seems like it's not the right solution, because at the end that can actually have the compounding effect of different problems that can come not only for us but also for our family members. We can also choose to be tough enough to acknowledge it, have a conversation with ourselves and then with our family members. And also, we can decide and choose how we're going to interpret that message and bring it back to today. And how is that going to affect the amount of gratitude I have for today? How is that going to affect the amount of gratitude for me, knowing that somebody is here with us, right? So lots and lots of optimism that can be derived from something that is so dark. But even that darkness, with an optimistic point of view, I will tell you how I see it, which I have no idea if this is the right way to see it. It's just like a dark room. You turn off the lights in the most beautiful mansion with the best people in it that are possible. If you turn off the light and you put somebody there, and because they don't see it, what's the first response they're going to have? They're going to be afraid because they don't know where they are. They don't see. When the light comes on, and that's where within my optimistic mindset, I think that when people see light, at the moment of transition, all these stories, life after life, all that stuff, that is the light that can actually shed the light on something that we cannot possibly comprehend right now. But having a conversation, being prepared for certain things, and actually realizing that we control how we're going to interpret this, how it can affect our life positively today. I think this is a big takeaway. I don't need two from you. This is a big one that I got today, and big thank you for this. Seriously, it's so meaningful, and while it's so tough, it definitely landed in the right spot for me, and hopefully for our viewers and listeners. Where can people connect with you? How they can find you online and offline, to connect with you?
Yeah, I mean, my practice is here in Los Angeles. It's called Evolve Healthcare, and you can learn about it at evolvehealthcare.com. And I'm active on all social media platforms at Dr. Gary Evolve, so at Dr. Gary Evolve. And that's the easiest way. I'm most active on Instagram, but I'm getting more active on the other channels. I also have a podcast called the SAPIEN Podcast, and you can find that everywhere podcasts are found. I did 2 or 3 seasons all about nutrition, and I've transitioned now to talk about this spiritual connection to healthcare. end of life care, psychedelic medicine, mental health care. I just think that it's the next step for me. And I'll just mention I am working on a book kind of connecting these dots, how we live and how we die. I'm really excited to announce that. And how to live and how to die. And hopefully that's forthcoming. And yeah, reach out to me. You could reach out to my practice, and yeah, it would be an honor.
Fantastic. For our listeners and viewers, some of them are providers themselves. Some of them are individuals who are looking for clinical solutions. How can we as a group support you? What can be done to support you?
Oh, that's so sweet. Look, I love connecting with people that are interested in moving healthcare forward. So if you want to talk to me, if you want to learn about how I built my practice for providers, I love to share how I built my practice, strategies that have worked for me. I have a great relationship with the podcast community, and I'm trying to grow that. So I'm happy to, talk with anyone, share my story. I have my podcast if you'd love to join me. We're just finishing up the studio here, so that's really exciting. But yeah, I'm very connected to my community. So if you have questions, if you have any way we can collaborate, just reach out directly to me, and I'm an open book.
Super. Big thank you. Have a wonderful day. And thank all of you for listening or watching.